Have you ever looked at your partner and felt a sudden wave of panic? Maybe you've asked yourself, is this really the right person for me? Or how do I know for sure I'm actually in love? We all have doubts sometimes, but for some people, these aren't just passing thoughts. They are symptoms of something called Relationship Obsessive Compulsive Disorder, or ROCD. Today, we're counting down the top 3 ways OCD can hurt a relationship, and make sure you stick around to learn exactly what to do about it and our advice. Hi, I'm Dr. Shauna, and I'm a double board certified psychiatrist and OCD specialist, and you're watching Mental Health Explained. Let's get into it. First, we need to understand the OCD loop, obsessions and compulsions. Think of it like a brain glitch. It starts with an obsession that's a scary, stuck thought that plays on repeat like a song you can't stop. To make that fear go away, you perform a compulsion. That's an action or a check that makes you feel safe for a moment. While some people might wash their hands to feel clean, with relationship OCD, the stuck thoughts are all about your partner. Your brain treats a tiny what if like a massive emergency, keeping you trapped in a loop of worry. Starting at number 3, OCD is the time thief. Because people with ROCD feel like they must perform certain rituals to feel okay, those rituals end up stealing their time. These are the compulsions we just mentioned. For example, if you feel like you have to check your partner's social media or spend an hour fixing your own appearance before you feel ready to go out, you're going to be late every single time. Over time, your partner starts to feel like they aren't a priority. It's hard to have a relaxed, happy relationship when OCD is the one running the clock. Number 2 is the reassurance trap. This is a huge compulsion in ROCD. It sounds like asking, do you love me or are you mad at me, dozens of times a day. You're trying to kill the doubt in your head. When your partner says, yes, I love you, you feel better, but only for a minute. Then the brain glitch comes back with more questions. It's like trying to fill a bucket that has a hole in the bottom. Eventually your partner gets burned out because they feel more like an emotional alarm clock than a partner. Finally, we reach number 1, the most important part of ROCD, the magnifying glass. In this mode, your brain acts like a giant lens focusing on your partner's flaws. It picks one tiny thing, like the way they laugh, what they're wearing, or a small mistake they made, and makes it look like a total disaster. You start thinking, if they have this one flaw, they must be the wrong person. This makes your partner feel like they're constantly being judged. It's impossible to feel close to someone when you feel like you're being graded on a test every single day. Now, it's important to note other conditions that may play a part in ROCD. Anxious attachment is a habit you learn when you're young. It's being clingy because you're afraid of being left. Rejection-sensitive dysphoria, RSD, is different. It's a biological brain reflex common in ADHD. It's a sudden, sharp pain you feel when you think you're being rejected. Knowing if your problem is a learned habit, a reflex, or OCD is the first step in choosing the right way to heal. Now, let's talk about how to fix it. ERP therapy. Now, many people ask about CBT, or talking therapy. The problem is that in OCD, standard CBT can actually make the thought loop worse. If you spend all your time talking about your doubts, your brain thinks these doubts are a real emergency. Instead, we use a special kind of CBT called ERP, which stands for Exposure and Response Prevention. In ERP, we practice sitting with your doubts. If your brain says maybe you don't love them, instead of running for a hug to feel safe, you just say, maybe I do, maybe I don't, and you keep going. This teaches your brain that the scary thought isn't a monster, it's just a thought. We also use mindfulness and medicine as support tools. Mindfulness is like watching your thoughts float by like leaves on a river. You see the thought, but you don't jump in the water to grab it. Medicine can also help turn down the volume on these loud, intrusive thoughts. It doesn't change who you are, it just makes it easier to do the hard work in therapy. If you want to know more about these medicines' work, I have a separate video on this channel all about anxiety medicines that you should definitely check out. When you start treatment, you begin reclaiming the relationship. When you stop the constant checking and the endless questions, your partner gets to stop being your anxiety coach and goes back to being your partner. This changes everything. Your relationship stops being about managing a crisis and starts being about having fun again. You finally get the space to be yourself and actually enjoy your time together without the constant noise of doubt. Here's my advice. If your relationship feels like a 3-way between you, your partner, and your OCD, you have to stop the reassurance loop. Reassurance is gasoline for OCD. It only makes the fire bigger. The goal of treatment isn't to be 100% sure about your partner, because no one is 100% sure about anything. The goal is to be okay with not knowing for sure. When you stop looking for proof of love, you can finally start feeling it. If this helped you, hit the like button and subscribe. I'm Dr. Shauna, and I'll see you in the next one.